Hello, my name is Don Schweitzer, and I'm here today to go ahead and speak to you about the MS Society and actually plead for you for help in supporting this society. The reason I am involved with this is my mother has had when she was living, she had MS, and she had it in her mid 30s, and I've been involved with it basically since I was in my early teens, mid teens, and that's when my mother was diagnosed with the MS. So, um, and this is why I'm here today to speak with you because of I dealt with it most of my life until my mother passed away. Um, It's about 7 years ago she passed away due to this disease. It came from the complications. And also, I have a sister who has MS. At one time, it was not thought to be heredity, and they still are not saying that it's actually heredity, but you stand a greater chance if you have another relative who has MS. And people say, what exactly is MS? Well, according to an article written by Healthline by Ann Piertingale, Pier, Pietrangelo, Pietrangelo, hard name to say. On May 15th of this year, she describes multiple sclerosis as a chronic illness involving your central nervous system. The immune system attacks the myelin, which is the protective layer around nerve fibers. This causes inflammation and scar tissue or lesions on the brain or even your spinal cord. And what happens is then it makes it hard for your brain or your spinal cord to send the signals to the rest of your body, which causes the problems. Now, people wonder what the symptoms are, and there's a list of symptoms. Just because there's some on my read here, um, you may have it or somebody you know has these symptoms. It doesn't necessarily mean you have MS because some of these symptoms can be the results of some other things going on in your life, like medication. You can change a medication and can cause some of the problems. And as long as you know there's something going on like that could possibly be causing this, then there's not as much of a worry about that. But, if you don't have any underlying causes like that, then it's best to go see your physician and go from there. Um, a lot of the people experience fatigue. And like I said, because of my mother, a lot of these are very familiar to me. They experience fatigue, they experience numbness or tingling in their extremities. There's a weakness. They have walking or gait issues. They have spasticity. They have vision issues, which a lot of the MS patients end up with glaucoma, dizziness or vertigo, and bowel problems. These are some of the common symptoms. Though, like I said before, it doesn't mean that you have MS, especially if there's an underlying problem going on. There are less common symptoms that some people don't know about, and there are speech problems, tremors, breathing issues, swallowing problems, seizures, and hearing loss. The seizures usually come in younger patients, and by younger I mean in their teens or even younger, believe it or not, because the age is somewhere between 20 and 40 is when people usually MS shows up in patients. And there's an article written by Yvette Brazier for the Medical News Today. And it goes on to say, it says, it is difficult to know precisely how many people have MS. According to the National Institute for Neurological Disorders and Stroke, 250,000 to 350,000 people in the United States are living with MS. But then when you go to the MS Society page, they claim that there could be as high as 1 million people. And there are also some risk factors, and that is things like, again, heredity. There belief that there are some genetic issues or even some cell issues that can cause MS. And most people with MS have what's called a relapsing remitting disease course. And what that means, they experience symptoms of MS, even new symptoms or relapses that develop over days or weeks and usually improve partially or completely. They go away. These relapses are followed by quiet periods of the disease, which could go anywhere from months to years. You just don't know. And MS in every person is different. Even my mother and my sister is totally different the way either one of them reacted to the disease. Small increases in body temperature will affect an MS patient. The weather we're having right now, my mother could not be out in it. You had to have the air conditioning in the car and have the car cooled down before she even got in it, because if you put her in the car with that temperature, it would cause her to start just losing her function as far as being able to do anything. Your normal temperature is 98.6. My mother couldn't have a temperature 98.6. If she had a temperature 98.6, she was bedridden for the day. She was unable to get out of bed. She was unable to do anything. I mean, as far as even feeding herself, and it took all she could do just to even drink. So, I mean, temperature has a big impact on what happens to an MS patient. 50% of the ones with the relapsing remitting MS eventually developed a steady progression of symptoms, and it happens with or without remission. Like I said, my mother, from about the time she was in her 50s, late 50s, early 60s, she ended up being in a wheelchair all the time. Up until that time, from her mid 30s on up, till then, she walked with a cane, then she walked with a walker, and then she at times had to use a wheelchair, but then it got to be a point that it was a constant wheelchair. And that when that happens, that's called known as secondary progressive MS. It's just something that they know does happen. And the worsening of the symptoms usually include problems with their mobility and gait. Again, like my mother, she ended up being in a wheelchair constantly. And excuse me. Some people with MS experience a gradual onset and a steady progression of signs and symptoms without any relapse. And that basically was the way what my mother was. She may get worse because of a temperature or something like that, but she always basically went back to what she was, and then it was just like a steady. My sister is different. My sister can have bouts of better days or weeks, and then a period of time where she has a lot of issues. And according to a medical author written by article written by a medical author, Dwight C. Taylor, from Medicine Net. There are 4 types of MS, and there is no one test to diagnose MS. When my mother was diagnosed, it basically was they ran all these tests on her to see what it was, and when it come back that she didn't have any of the things they tested her for, she has MS, and that's the way they did it. And again, like I said, that was over 30 years ago. Now, doctors and other healthcare professionals diagnose the disease by patient history, physical exam, and tests such as MRIs, where they're looking for the lesions, the white spots on the brain or the spinal cord. Lumbar puncture, where they pull fluid from your spinal area, and the evoke potential testing, which is speed of nerve impulses. Okay, where they hook you up and they shoot electrical charges through your nerves to see how your different parts of your body would react to that. And other tests may be done harking back to the days of checking for everything else, and then you have MS. They still do other tests to rule out other diseases such as like Lyme disease or things like that. So the four types of MS are relapsing remitting multiple sclerosis, secondary progressive multiple sclerosis, and that's the most common type, primary progressive multiple sclerosis, and progressive relapsing multiple sclerosis. Now, I've been telling you, giving all this background information because I would like you to help out with the MS Society and help them out to get rid of this horrible disease. That actually was founded on March 11th, 1946 by a lady by the name of Sylvia Lowry. And it was incorporated as the Association for Advancement of Research in Multiple Sclerosis. And its sole purpose was to sponsor MS research. In 1947, it was actually renamed to National Multiple Sclerosis Society. And it started out as an attempt to gather information on her brother's. Her brother had MS, and they were trying to find out they didn't know it, and they were trying to find out why his symptoms. She, in an attempt to find out if anybody else would know, she placed in a small ad in the New York Times in 1945. And it just says multiple sclerosis. Will anybody recovered from this, please communicate with patient. That's what her ad was. Well, she actually received more than 50 people responding to her, and they were her brother, and they were all as desperate as they were to find answers, a cure, or even encouraging news. And she realized at that time that they need to have an organized effort to finance treatment and for curing this horrible disease, and that is how what is known as the National Multiple Sclerosis Society became founded on March 11th, 1946. A biography was written about her life and impact on MS movement, and it's called Courage, and it was published in October 2003. Sylvia Lowry passed away February 24, 2001 at the age of 85. Now, the research and involvement. There's a lot of things you can do. A lot of things. I'm just going to run through some of the few that here quickly. One of the things you can do is actually go to their website, just type in National MS Society, and it'll come right up. Um, you actually can be part of research studies as a volunteer in genetic studies, and you would participate in genetic studies. They would look at, I guess they would pull all kinds of cell samples and things like that. Um, you can donate to tissue banks, and donating to the tissue banks, they would take samples of your tissue, and they not only take it yours, a healthy person, they would also take from MS patients also, and they freeze it and they keep studying and trying to look at to find out the thing that jumps out and say, hey, this is the cause. As of yet, they do not know. You can participate in things such as MS walks and runs. They have them throughout the year. And usually the way that works is there gets groups of people together. Usually a lot of corporations are involved with that. And what they do is the individual goes out and gets donations for them to walk or run in the walk or run that they're having. And so that's how that's done there. Um, all this money that's gathered, there is many ways the funding is used. Um, they Last year they recruited and provided training to more than 1,000 new MS researchers to the field. They provided early career support and funding to nearly every, and this I thought was unusual. I never heard of something like this, but I understand the thought behind and it is called Thought Leader in MS Research. And that's, this is people that they're the ones that come up with ideas that maybe this might be the cause, and they research it and see if that's the cause of it. And they also set standards in diagnosis, symptoms management, and pediatric MS. And yes, I did say pediatric MS because it has occurred in young people. Very rare, but it has occurred. Um, and they also they set the standards in complementary and alternate medicine, rehabilitation research, clinical trial strategies, and stem cell research. They established the MS field of nerve and myelin repair, which resulted in trials for treatment. They drove research uncovering genes contributing to MS susceptibility and new treatment avenues. They paved the way for all existing therapies, none of which existed just 30 years ago. And when you think about that, to me especially, 30 years ago is when my mother contracted her MS. The importance of this research. Their main thing, MS Society will tell you, their main thing is they want to find a way to stop all disease activity, and they want to prevent further progression for those who are already affected with MS. And in just a few short years, a whole new field has been emerged to pursue strategies to repair the nervous system and restore function to people with MS. So, I mean, they have a lot that is going on in the background. And like I said, because of having family members with this, it strikes a chord with me, and I would like if you would also think about it. And like I said, if you know anybody, please talk to them, and if I can't motivate you, hopefully they can. Now, I will tell you, not all MS patients will be in a wheelchair or whatnot. There are many of them who you don't even know have MS until they have a relapse. So, I mean, it's something that's it's a horrible disease. There's some famous people that had it. Terry Garr, and maybe because you're a little bit younger here, Annette Funicello. She had MS. And there's several other actresses and actors that have the MS. One other thing, it is more common in females than it is men, but the men's symptoms tend to be a lot worse. So again, I appreciate your help, and I plead with you, please help the society. It's a nonprofit, and your money and your time will be well used. Again, thank you. Goodbye.